Welcome everyone. I'm excited to kick off today's session on Prometric exam preparation. Today, we'll be focusing on Pediatric nursing MCQs for the Prometric exam. In this presentation, I'll guide you through key strategies and important topics to help you succeed. We'll cover exam structure, common questions, and effective study tips. Let's get started and make this a productive and engaging experience. Now, let's take a look at the MCQ and explanation related to the pain scale for infants. This section is crucial because accurately assessing pain in infants can be quite challenging, given that they cannot verbally communicate their discomfort. The key here is understanding the different methods and scales used to evaluate their pain levels effectively. The pain scale for infants often relies on observable signs such as facial expressions, crying, and body movements. These signs help healthcare providers determine the severity of pain and decide on appropriate interventions. It's important to appreciate that these scales are not just about labeling pain. They are vital tools for ensuring infants receive the necessary care and relief. By understanding how these scales work, we can better connect our assessments to the overall goal of improving patient comfort and outcomes. So, as we continue, keep in mind that these tools are foundational in pediatric pain management, helping us provide compassionate and precise care even when our young patients can't speak for themselves. Let's take a closer look at the pain scales used for infants. On this slide, we see 4 options: FLACC, numeric, faces, and visual analog. The correct answer here is A, the FLACC scale. Now, the FLACC scale is particularly useful because it assesses pain based on 5 different categories: face, legs, activity, cry, and consolability. This makes it especially valuable for infants who can't verbally express their pain. In contrast, the numeric scale relies on the child's ability to understand and use numbers, which isn't possible with very young infants. The faces scale, although helpful for older children, uses facial expressions to gauge pain, and the visual analog scale involves marking a point along a line, which again isn't suitable for infants. So, when we're working with infants, the FLACC scale is our best tool because it allows us to observe and score their pain based on observable behaviors. This aligns with the overall goal of accurate pain assessment in nonverbal populations, ensuring we provide appropriate care. Now, let's look at the different pain assessment tools and when they're most appropriate. The FLACC scale, which stands for face, legs, activity, cry, and consolability, is specifically designed to assess pain in infants and young children who can't communicate their discomfort verbally. It relies on observable behaviors, making it ideal for this age group. On the other hand, numeric and visual analog scales require the individual to have the cognitive ability to quantify their pain. So these are more suitable for older children and adults who can understand and use the scales effectively. Then there's the faces scale, which is typically used for children aged 3 years and older. These children can usually point to a face that best represents their pain level, making it a useful visual tool for them. So, putting it all together, the correct assessment method for infants is the FLACC scale, because it doesn't depend on verbal communication or complex understanding, unlike the other scales. This highlights the importance of choosing the right tool based on the child's age and developmental level to ensure accurate pain assessment.